Hi, in this video we shall talk about the male reproductive system and the various organs involved. The male reproductive system consists of the testes, a series of ducts, a number of glands, and the penis. The testes are the primary organs of the male reproductive system. They are responsible for the production of male gametes, that is the sperm cells. The testes appear to be suspended, even though they are not, by the paired spermatic cords within the sac of skin and thin layer of fibro-muscular tissue known as the scrotum. Development of the male germinating cells, that is the sperm or the spermatozoa in the testes, requires a temperature slightly lower than that of the body. This can be achieved in the scrotum, where the germ cells are separated from the warmer body and the body cavities. The temperature within the scrotum can be adjusted slightly by the contraction or relaxation of the smooth muscle known as the dartos muscle in the scrotal wall. This causes tightening or loosening of the tension of the scrotal skin about the testes. The ureters are tubes made of smooth muscle fibers that propel urine from the kidneys to the urinary bladder. In the adult, the ureters are usually 25 to 30 centimeters long and approximately 3 to 4 millimeters in diameter. Histologically, the ureter is lined by urothelium, which is a type of transitional epithelium and has an additional smooth muscle layer in the more distal one-third to assist with peristalsis. The bladder is a hollow, muscular, and distensible or elastic organ that sits in the pelvic floor. Urine enters the bladder via the ureters and exits via the urethra. The prostate surrounds the urethra just below the urinary bladder. That part of the urethra located within the prostate is called the prostatic urethra and merges with the two ejaculatory ducts. The seminal vesicles are a pair of glands that are positioned below the urinary bladder and lateral to the vas deferens or the ductus deferens. Each vesicle consists of a single tube folded and coiled on itself with occasional diverticula on its wall. The excretory duct of each seminal vesicle unites with the corresponding vas deferens to form the two ejaculatory ducts, which immediately pass through the substance of the prostate gland before opening separately into the prostatic urethra. Each seminal vesicle spans approximately 5 centimeters, though its full length unfolded is approximately 10 centimeters. The bulbourethral glands are a pair of compound tubulo-alveolar glands lined by simple columnar epithelium. The mucous secretions from these glands serve to clear the urethra of urine and to lubricate it, and also produces energy for the spermatozoa. Mature sperm are stored in the epididymis. With stimulus and in addition to their own motive power, sperm cells are induced to move quickly through the epididymis and the ductus deferens by rhythmic contractions of the smooth muscle in the ductal walls. The ductus deferens, with its blood vessels and coverings, enters the superficial inguinal ring at the medial attachment of the inguinal ligament. It passes through the abdominal wall and within the inguinal canal for about 4 centimeters to emerge through the deep inguinal ring, wrapped in a layer of transversalis fascia known as the internal spermatic fascia, which is located deep to the oblique muscles of the abdomen. Each ductus deferens enters the retroperitoneal pelvic cavity, passes over the iliac vessels, crosses the ureter, and bends sharply behind the urinary bladder. It then descends to join with the duct of the seminal vesicle in the posterior wall of the prostate gland. The union of the ductus deferens with the seminal vesicles forms the pencil point-shaped ejaculatory ducts that opens into the prostatic urethra. The nutrient-rich secretions of the prostate gland and the seminal vesicles are then added to the population of sperm, making up the semen. Prior to expulsion of the semen by way of ejaculation, the bulbourethral glands, which are located on either side of the base of the penis and inferior to the urogenital diaphragm, add secretions to the spongy urethra, providing lubrication during intercourse. The testicular arteries arise from the abdominal aorta just below the renal arteries. The testicular vein leaves the testes as the pampiniform plexus of veins. So we can observe here the relationships of the testicular artery and the ductus deferens to the venous plexus. The fundiform ligament of the penis is a specialized thickening of superficial fascia from the linea alba of the lower abdominal wall. It runs from the level of the pubic bone laterally around the sides of the penis and then unites at the base of the penis. Thanks for watching. Please like this video and subscribe to the channel. More videos coming up. See you in the next one.